So Irish families tend to not to want to come to programs like this on Friday nights or at the weekend, and that's what we've learned over the last couple of years. So the families arrive at 6 p.m. and they're welcomed by the site staff and the site coordinator. They're served a family-style meal, which is a major, it removes a major obstacle for some families, because I think Martin mentioned that these families, some have been at working all day. The last thing they need to do is come home from a busy day, try to check the children's homework, prepare a meal, clean up, and then rush out to a family program. So this meal removes a major obstacle for families attending. Following the meal, the parents go into their parenting skills training class, and the teens go into the teen skills training class. And in the second hour of the evening, the families come back together and they have an opportunity to see these skills demonstrated by the group leaders, and they also have time to practice themselves and get feedback from the group leaders. And then they're encouraged enthusiastically to try these skills in the home environment the following week, and then come back and process that in the group again the week after. And while all this is happening, childcare is provided for the children outside of the target age group, and transport is also provided to get the families to and from the site. While professionally trained social workers or psychologists aren't needed to deliver the Strengthening Families programme, it's still required to have 5 staff work at night over a 14-week period to deliver the programme. A lot of the agencies in Ireland perceived this as a huge contribution to make in terms of allocating time and resources. So, and also, as there is no one agency with the solution to child and adolescent development problems, what we seized on was an opportunity to develop an interagency collaboration model to deliver the Strengthening Families programme. The interagency approach that we used allowed us to harness the distributed expertise among a number of statutory, voluntary and community agencies to deliver an evidence-based programme to the whole family. The primary collaborations have been between the Health Service Executive, local and regional drugs task forces and young persons probation that operate in each county in Ireland, and they provide funding for the implementations and evaluations. And this also allowed us to have the best staff available, gender matched and ethnically matched to the families for the group leader and site coordinator positions. It also allowed us to implement high quality programs and try as best as we could to retain fidelity to the original core content. Some of the unforeseen benefits for the interagency collaboration model have been improved relations and communication between systems of and communities of practitioners, and also a shared use of conceptual and practical tools. The Irish National Drug Strategy, which also includes alcohol since 2009, has recognised the Strengthening Families programme as part of its national approach to substance misuse prevention. And the Young Persons Probation Strategic Plan has also adopted the Strengthening Families programme as part of its approach to divert adolescents from the criminal justice system. The Irish dissemination process began with the Health Services Executive and local and regional drugs task forces contacting Professor Carol Comfer and Dr. Henry Whiteside at the International Training Centre in Salt Lake City in Utah to discuss which version of the Strengthening Families programme would be best suited to address the identified needs in the Irish setting. Following this conversation, it was decided that the 12 to 16-year-old at-risk version would be the programme that would best suit the local context. And this led to the first group leader training in March 2006, where Professor Comfer and Dr. Henry Whiteside came and trained 50 professionals to deliver the programme. We trained so many, although you only need 5 technically, We trained many more, so that a lot of the agencies that may not allocate staff to deliver the program would eventually become referral sources who understood how the program worked and what was needed to get these families through a huge commitment of 14 weeks of an intervention. I think I was on the wrong slide. Okay, so following on from the group leader training, Arbour House in St Finbarr's Hospital, where I work, took the lead and ran a pilot program in January 2007. The program started with 10 families and 9 completed the 14-week family skills training intervention. This in and of itself was a huge improvement for our services, because we were used to seeing up to 50% dropout rates from our family programs. The original pilot program of the Strengthening Families program was implemented in its original format with only minor adaptations to suit the local context. Later, when we were able to recognise what was working and what wasn't working so well in the Irish context, we decided to culturally adapt the program materials and curriculum. The families on the original pilot program reported improvements in areas of family communication, family dynamics, and also in family conflict. Since that pilot program, the Strengthening Families program has been delivered on an interagency basis right across Ireland. It is funded primarily by the local and regional drugs task forces and young persons probation, with each area developing its own implementation working groups to oversee the implementation and evaluation of the programs. We've got money from central government funding streams, as well as the National Lottery, Atlantic Philanthropies, and community and voluntary sector donations. In 2009, the Young Persons Probation employed a National Strengthening Families Programme coordinator, and in 2010, the Northwest Alcohol Forum employed a coordinator in Donegal to oversee implementations along the border counties with Northern Ireland and the UK. Both of those coordinators facilitate the implementation and evaluation processes, and we've delivered the 12 to 16-year-old at-risk version, and some areas have also delivered the 6 to 11 programme. We held a focus group in 2011, and we invited 25 of the stakeholders to come together to look at what had been achieved, but also to surface and work through some of the tensions and dilemmas that had arisen in interagency practice. Bearing in mind that for some, cooperating, collaborating, and getting along together appears to be a very unnatural act. To just briefly describe the origins of SFP Ireland, originally 8 experienced group leaders who had implemented the Strengthening Families programme trained alongside the programme developer to become group leader trainers themselves. This led to the development of SFP Ireland, and then SFP Ireland working alongside the local and regional drugs task forces to assist them to develop their own training systems to address issues of staff mobility, staff unavailability, and to try to ensure sustainability of the model in Ireland.